trick you're not gonna get in a manual is I would take your skin prep pad that you just used on the bare skin and I would skin prep over that too. And what it does is it seals it down and it pushes out all the little air bubbles and you can actually kind of hear it. You don't need to put it over the foam, obviously, okay? So this piece here is your SensaTrack. This is the part that is going to connect to the foam. Inside here are two little circles. There are sensors in there that help to determine how much of a negative pressure pull is going into the machine. So in order for that to be accurate and to know how much of a pull is inside the foam and going to the machine, you need to make sure that you have a hole big enough to catch at least up to this rim right here in your foam, okay? So quarter size. Makes sense? So basically what I would do is I'm gonna pull up from here and I'm gonna cut out a quarter. It does not have to be beautiful. It just has to be big enough to where I can squeeze that SensaTrack on there, right? Same thing, 1-2 blue. One thing you want to be conscious of when you're putting this on is where the wound is and where is this vac going? How are they going to hold the machine themselves? So let's just say that this is on the front of somebody's thigh and they have shorts on and they really want the tubing to come up their shorts because the vacs that they usually carry have a shoulder strap, okay? So don't turn it this way because then now you got to come up this way. Make sure that you're placing your SensaTrack in the same direction where you want your tubing to go. So same thing, 1-2 blue, okay? You're gonna pull off your number 1. Here's your number 2. Go ahead and take that off. You can hold on to this because it's gonna come off. You want that center part there to be in the center part of your hole there. Down. Done deal, okay? And then you grab your number blue here and that's gonna come off there, okay? Same thing, I would take that skin prep and skin prep it down. So at this point, technically, you could just hook it up to the vac and go. Another tidbit that I do though, because I've seen years of non-compliance, if somebody's walking around and this tubing is here and it's hooked to their machine, they pull, that hurts. That's not fun. So one thing that you may want to do is take you another little extra strip from your piece, wherever I had that piece I started. Here. So I would probably take 2 pieces. I would cut a little strip here. I would take this piece and just go over the top of the SensaTrack right there, just to make sure that it stays in place, which again, this is probably all overkill. But if you can't make your patients be compliant, you're wasting your time. So then I would take this also and set yourself another anchor so that when they're walking around and they're tubing here and it catches on something, it doesn't pull from here. I'm gonna tape that to their leg right there. So when they snag that vac bag or wherever they're holding on, that first snag is gonna pull from here, not from their wound site, okay? And you can do that wherever you want. So basically, our pretend box, your canister, I promise y'all, when I normally do wound care, it's not this messy. You have your canister hooked into your machine here. You take the top off. You're gonna push, watch these little edges. Push all the way through here and spin. Make sure you are not clamped here and here. You turn the machine on and it goes rrrr, and this sucks all the way down flat, just like that. And that's it. So when they come back, you will have them turn the machine off. You want to clamp these because if there is drainage in here, you don't want it flying all over the place. You will take it apart here, just like this. This probably will not be stuck there anymore. And then another trick is, y'all seen Unisolv or any types of adhesive remover. So you can imagine if you had tape stuck to your arm or your leg and it's the winter and you haven't shaved and somebody's pulling tape off of that area over and over and over, that would suck a lot. It's not comfortable. So always put yourself in that position that your patient is in. Find the edge of your tegaderm here, get your Unisolv and Unisolve as you pull up. A lot of times they will tell you to pull parallel to the skin. Regardless, use your Unisolve. When you get close to the black foam, don't use the Unisolve because there's alcohol in it. And it will get in the wound bed and it will burn your patient and they'll be really mad at you. So while you are trying to be nice and help them to get this sticky off, stay away from the black foam with it, okay? Come all the way around. Bam, when you take it off and you take that out, you're probably gonna have a whole lot more of red buds. This may stick to the wound bed some. It's not a bad thing, it's okay. When it comes off, your granular tissue is gonna almost resemble this. If it's horribly painful when you're removing it, you can always get these pieces here and even just take a full piece and lay it into the wound bed. It's called a contact layer. It helps with patient pain when you're removing the wound vac. You can always put that down. It's not gonna hurt anything with the suction or anything like that. And you will see a major difference in the size of those wounds. Plus, it's also your drainage management. I mean, if you have a lot of wounds where you can't change an outpatient person, you can't see them 2 times a day, but their drainage needs to be corrected in that manner, that's always a good option as well.
And you didn't have to be sterile for any of that removal.
Well, yeah, you did.
You did.
Not for the removal.
Okay.
Not for the
Oh, okay.
removal.
Okay.
Not for the removal. When you're fooling with the foam, you should be. You
Okay.
should be, because that is going into the wound bed. And everything that is in a package is sterile. When you're taking off dressings, there is no need to be sterile because none of those dressings are sterile. They've all been in contact with the wound, and that wound is not sterile. So does that make sense?
When the patient comes in and you take their back off and you're gonna put a new one back on, you wanna throw this away, you discard this in the biohazard,
So
or do they clean
with
it?
no, you're not cleaning
Yeah,
that.
I was gonna say.
No. So in the inside of that is a solidifier. It's basically so that it can collect as much drainage and hold more in here. On the side of it tells you how much drainage is in there. You document how much is in there each time. You document if and when you do change a canister. You should change a canister at least 1 time a week. If it's full, change it. A lot of times patients will come in, you'll change it, they'll go home, and the next day it'll be full. They'll have to change it, and that's okay too. Just make sure you do your clamps before you take it off.
Can they shower with that on?
So,
Okay.
definitely cannot bathe like in a tub. If you have a wound vac on and it's on the front of your leg and they can stand in a shower and let the shower with their back, I would not have the water on it. And again, that would also depend on the compliance of your patient. You know, is it somebody they're gonna shower and every time they shower it keeps coming off? Then I would tell them to take a cat bath. We're worrying about the shower, just don't stink when you come in. Is it, if it's in a precarious spot, if it's on their glutes, if it's something like that, then obviously you're going to want them to try to avoid that as much as possible. Any other questions?
How long do they have to keep that on for?
I would keep this on as long as you can until it heals up. Usually these dressing changes are usually done 3 times a week. Possibly 2 times a week if there's not as much drainage. Depending on if your doctor lets you do what you want to do. The pressure is typically at a low continuous pressure of 125 millimeters of mercury.
You might have said this, but do y'all measure how much comes out?
The drainage?
Yeah.
Yep, you'll document it. So like if they come in on Monday and it's about
There it
it's about right here, I'm gonna document, and it's about 25 milliliters. And then when they come in Wednesday, I'm gonna put 50 milliliters. And then Friday, if we haven't changed the vac yet, I'll come in and say, oh yeah, it's 150 milliliters. And then I'm gonna mark, change the canister, so that they know when they come in Monday and there's only 25, you know the difference and why that is. Also, the other thing, I only put 1 piece of foam in this wound bed. You wanna document the number of pieces of foam that are put in a wound bed. Because when they come back the next day, whoever saw that person before, if they put in 2 pieces, you better take 2 pieces out, and you better document that you took 2 pieces out, okay? In this case here, I don't know if y'all could see with this little tunnel thing here, if it was deep enough, you could take a piece of the white foam and make you a piece just long enough to fill that space and have it in contact with this foam here. Where's the scissors? I'll show you.
It should be that way somewhere. From when you cut the silver stuff. I mean,
Okay.
that's going to the clean stuff, whatever the color it is. Jesus Christ.
Yeah, so
What a struggle.
if I had a tunnel big enough here, if that tunnel was big enough, I could take a Q-tip here, take the blunt end of it, put it in just to fill space. Obviously this tunnel is not very big at all, but if it was, take it here, catch it to fill space, pull my Q-tip out. That's in there. As long as I put this in and it's in contact with that other foam, the suction goes right through it.
And that would be better than not having something in there. 'cause
You need
then
to
it
have,
could-
something has to
yeah.
be in there. If
Yeah,
there's a,
because you
if
wanna
there's a
have-
tunnel,
otherwise you'll create that
because if not, you know what'll happen? You'll have this right here, that'll close up right there. But then what happened to the 4 centimeters that was open before? Now it's gonna hold drainage in there, and then what's gonna happen? You're gonna have an abscess. Always have to make sure your wounds heal from the inside out. So what if, how do you know